Well, good afternoon and thanks for joining us. My name is Rebecca Fincher and I'm the Chief Administrative Officer here at Conway Regional Health System, and today we are joined by Dr. Tom Roberts. Dr. Roberts, thanks for being with us today.
Great to be here, thanks.
Well, these videos are primarily for social media and it's our way of communicating with the communities that we serve. So today, Dr. Roberts is here to talk just a little bit about preparing for the upcoming athletic season. So Dr. Roberts, before we kind of get into that, maybe take a few moments and tell us just a little bit about yourself, how long you've been on staff, what your specialty is.
So I'm an orthopedic surgeon that practices both orthopedics and sports medicine. I'm board certified both in orthopedics and sports medicine. My wife and I, Joni, moved here in 1992, so I've been on staff since, I think, February of 92, so it's been a long time. Been a good time, though, and love living here in Conway, and Central Arkansas has been our home, and we love it here. So.
Not many physicians can get down to the month and year since they've been on staff, so kudos to you. So as you said, you all have been here since 1992, and I know that you're very involved in the community, particularly involved with our schools and our colleges. Can you talk a little bit about your involvement outside the medical center with those organizations?
Sure. I've been working with UCA probably since '92, I believe. Work with all their athletic programs there. Between me and the famous physician at this point is Dr. Thad Harden. We cover basically all the sports, and I do most of the orthopedic stuff. He does a lot of the primary care stuff, and we work really well together. Randy Pastor's out there. He's full-time there at the university and also works with us in the sports department. Work with the athletic trainers there and just help them take good care of their athletes. Also work with Hendrix College and with CBC, and work with most of the local high schools, trying to help coordinate athletic care, try to do some things to help them manage problems, whether it's through rest, rehabilitation, or sometimes things that need surgery. So it's a pretty complex thing. We have a program here called CSOP, which we have a group of physicians that are all sports oriented, anywhere from orthopedic surgeons, primary care doctors, neurologists, cardiologists, ENT, just everybody that may be involved with sports care. We meet and try to manage as best we can, delivering good care to all the athletes in the area.
Yes, and you mentioned working with athletic trainers at the different colleges and universities. I know you've been heavily involved with the growth of the athletic training program here at Conway Regional. We have 13 athletic trainers headed up by Jason Caruth and yourself. And so I know over the course of the last few months as we've been meeting and discussing how do we best prepare for the upcoming athletic season, sports physicals is something that has kind of come up. So can you talk about the benefits of sports physicals, of school physicals, and how we should kind of approach that as we look to the school year?
Sure. I think, for the average parent or athlete out there, part of this is just, first of all, it's mandated. It's something that we have to do on a yearly basis here in Arkansas. So, and part of that it's to try to ensure that when an athlete begins a program, he's ready physically and hopefully mentally to do that. There's a lot of worry as people start into a season. Am I ready? And have I stayed in shape? And is 2 days going to kill me? What's this going to be like? So, doing the sports physical gives us a chance to review the history and the physical changes that may have occurred in an athlete from year to year, reviewing injuries, trying to make sure they don't have some underlying heart disease or other health issue that would make the sport they want to participate in dangerous, or maybe there's some things we need to modify, say for somebody that has asthma, making sure they have access to their inhaler and that kind of thing. So there's a lot of things that go into the sports physical. Unfortunately this year, because of the coronavirus, we normally have a really big physical, have hundreds of people come through all at once, and that just wasn't going to work. So we've tried to arrange times where people could come and get their physicals, and also just encourage people, man, go see your primary care doctor and get your physical done, because it has to be done. They won't let you play sports without it.
That's exactly right. And throughout the 7-county service area that Conway Regional serves, there are primary care clinics, there are pediatric clinics. So we encourage you, as you look to the school year, to seek out a primary care provider or a pediatrician to have your school or your sports physical done. And so as we approach kind of the school year and the athletic season, how should we handle preparing for the athletic season?
Wow, this is going to be an interesting year. You know, everybody wonders, well, what are sports going to be like? What's going to happen? And really, we're not completely sure. It's going to be a time that things are going to change. We'll have to adapt, because I'm sure that things are not going to be completely smooth. And I think part of that is just, I think athletes and families need to prepare for that. That it's going to be an interesting, unusual year. We may be able to complete some parts of the seasons, some of them maybe not. You know, we really don't know how this is going to play out. And having personally never been in a time where we had a pandemic like this, it's going to be different. I think for the average athlete right now, the hardest thing is to really try to condition yourself well to be ready for the sports season, you know, whatever sport you're playing. A lot of the gyms really haven't been open, and trying to work with the schools, it's just a difficult situation. So, you know, if I was preparing for a sport, I would look at what am I going to need to do to play this well, and try to focus on the things that maybe you don't really think about as much. Flexibility, which I think is huge. Most athletes, that's one of the last things you really want to work on. Strength training in the areas that you're really going to have some strength in, and then enough endurance training to be ready to participate. It's remembering back my time in sports in high school, it was I never was quite ready for the season to start because I wasn't in shape.
Appreciate you being here with us today, Dr. Roberts. Before we go today, is there anything else you want our social media viewers to know as we head into August?
Well, I think probably for the athletes, just prepare for the heat, because it's easier to stay indoors where it's cool, and most of the time we're going to be outside. I also think be prepared for some changes. It's going to be different, and no matter how much we try to plan it, it's going to shift and change some, and there's going to be some joy and also some disappointments, as there always are with athletics. It's just going to be a little different, but I'm excited. I'm excited that hopefully we're going to get to have some sports this fall.
Well, thank you so much. As Conway Regional has been the community's health system for nearly 100 years, we will continue to change, evolve, and adapt, and provide you information whether we're talking about preparing for COVID or meeting the community's needs. Thanks so much for being with us today.